Spinal stenosis and bulging discs are hot topics in physical therapy. Hi, it's Dr. Sarah here, your neighborhood physical therapist. Changes in the spine related to aging affect 95% of the people over the age of 50. So if you're in this age group, let me show you some physical therapy tips to improve your quality of life. So here's the first exercise for spinal stenosis. I'm laying here on my back, I'm on the floor, but you could do this easily on your bed. It would probably be easier to get up from your bed as well. And I'm going to bring my knee towards my chest. I can keep the other leg bent or straight, whatever's comfortable for me. And I'm going to use my hands to bring my knee into my chest. I'm going to hold this position for about 30 seconds or 10 seconds, whatever feels good to you. And what we're talking about with spinal stenosis is we're really talking about arthritis of the spine. So there's two structures at play here, the bones and the nerves in your spine. So what's happening here is that space between the bones is getting smaller, and it just so happens in your spine that nerves are coming out of those spaces between the bones. So as those spaces are getting smaller, there's a chance that the nerves will be compressed or squished, causing symptoms like tingling, numbness, pain, weakness in the low back and going down the leg. So when you're done with that side, you can bring your foot back down. You can try the other side if that feels good to you, or you can just do the side that you're having more symptoms on. And the same thing, you can hold this for however long is comfortable for you, 10 seconds, 30 seconds. And you can do this a couple of times, maybe 3 times. And you can do this throughout the day as well, listening to your body and seeing what is helpful to you. The next exercise I'm going to show you is a forward flexion exercise you can do sitting in a chair. So here I am sitting in this chair. I don't have to be on the edge of the chair or back, whatever is most comfortable for me. So I have my feet flat on the floor, and all I'm doing here is I'm rounding forward. I can reach my hands down my legs if I want to. I can hold onto the chair if I want to, whatever is most comfortable for me. So I'm going to create a rounded space in my low back. I'm going to show you this from a side view as well. So here's me from the side, and I have my feet flat on the floor, and I'm rounding forward, creating a rounded space here as I go forward. And you will find that a lot of these exercises for spinal stenosis do involve bending forward. Now, a movement to avoid if you have spinal stenosis is extension. So arching your back in any way if you have spinal stenosis is not a good idea. Walking is a great idea if you have spinal stenosis. You just have to pace yourself because you are in an upright position when you're walking. Staying still and stationary if you have spinal stenosis is also not a good idea because it will make you more stiff over time. So now I'm going to show you that forward flexion exercise standing against a wall. So I have my butt resting against the wall for a little bit of support and safety, and I can put my feet out in front of me a little bit, knees slightly bent. And all I need to do here is just reach down my legs a little bit, creating a rounded shape in my low back. So here I am creating that rounding shape, leaning forward, and I can hold this position for however long is comfortable for me, 10 seconds, 30 seconds, whatever feels good to you to give you a little bit of relief of those symptoms of the spinal stenosis. And this is a really great exercise because, like I showed you in the sitting position and now in the standing, you can really accomplish that anywhere you are. If you're out and about, if you're home, if you're sitting or you're standing, you can always just create that rounded space in the spine to give yourself a little bit of relief of those symptoms. Just like with any arthritic joint, the use of heat is beneficial for spinal stenosis. So you could always put a hot pack on your low back to improve your symptoms a little bit. You can leave the hot pack on for about 15 minutes at a time. I would just recommend not putting the hot pack directly on your bare skin and have some kind of a barrier there, whether that's your clothing or a thin towel. The next exercise for spinal stenosis is knee rotations. So here I am laying down on the floor again. You could be on your bed if you want to. My knees are bent, my feet are flat on the floor. And down the spine, we have all those. Your spine is comprised of lots of little bones going right down from your neck all the way down to your tailbone. And there's multiple joints between those bones, but one of them are called facet joints. And what happens is we know with arthritis that movement at joints is therapeutic and beneficial. So if we send our legs one side and then the other in this knee rotation exercise, we're creating movement at those facet joints and having an easier time moving one bone against the other in the spine. So here I am going back and forth slowly and gently. I can do 5 times, 10 times, whatever feels comfortable for me. If I could only do a small range of motion, just a little bit side to side, that's fine. Do what feels good for your body. So here's the figure 4 stretch in a seated position. So I'm sitting in the chair, on the edge of my chair, and say I wanted to stretch out my right side. I would just cross my leg over so that my ankle is resting on my left knee. And you might already feel a pulling sensation in your low back or in the back of your hip or your back of your thigh. And if you don't feel any stretch sensation in this position, you can always keep your back straight and lean forward to feel more of a stretch in that area. You can hold this position for about 30 seconds at a time is good, or whatever feels good to you. And then just return up to a neutral position. Bring that foot down, and then you can do the other side if that is helpful to you as well. Or really just the side that you have symptoms on, but it's a good idea to stretch out both sides. So you can hold this position for also about 30 seconds. And when you're done with that, just return your torso to the upright position and the foot comes down. Let me show you the figure 4 stretch done laying down. So if I wanted to stretch my right side, I would take my right leg and put it over my left leg. Both legs are bent here. And if I feel a stretch here behind in my low back or behind my thigh or my butt, that's great. If I don't feel that stretch yet, I can always take my leg where my foot is flat on the floor and I can bring it back toward so that all my legs are coming up towards my chest. And this is a great stretch. If the spinal stenosis is causing a compression of your sciatic nerve, leading to sciatica symptoms, stay tuned for my next video, which is all about rehab for sciatica. And I can hold this position for however long feels good to me, maybe about 30 seconds, and then I can let it down. And I can switch legs too. So my right foot is down, and I can put my left leg over, feeling a stretch there, or bringing my legs back towards my chest if I need more of a stretch. I also wanted to include in this video a little bit of information about core activation laying down in this position, because we know that having a strong core can support not only our extremities moving, but can also support our back. So what I like to do, what I would like to tell patients that have spinal stenosis is that when you're laying in this position, think about your low back area. Think about flattening your low back down onto the bed or down onto the floor. And that is what it's doing, is tilting your pelvis back. So if you think about flattening your low back and feeling your pelvis tilt up towards you, that is a good way to start to activate your transverse abdominis core muscle right here that goes across from one hip bone to another, and feeling that tightening there, like tightening up those muscles as if you're trying to get on a tight pair of pants, in addition to this pelvic tilt and flattening your low back to the mat, is really beneficial for starting to work on those core muscles to support your low back as well. So I would try to hold this position for as long as I can. And then when I feel my core muscles start to get tired, I would come out of the position to rest them. And then when I'm ready to go again, I would flatten my low back and I would tighten up these muscles that go from one hip bone to the other. I am so grateful to you for watching this video. Please like and subscribe to this YouTube channel. And please leave me some comments. I love to respond to comments. And let me know what your experiences have been with back pain and any other content you would like to see in the future.